My leadership story began from my early exposure to social work in India. I realized that leadership is about designing systems that actually make dignity measurable. My first lessons came from service, volunteering at Tata Memorial Cancer Hospital and supporting orphan children taught me that healing begins long before medicine, through listening, consistency, and compassion. Clinical dentistry trained me in precision, and consulting trained me in pattern recognition. While working with Deloitte and Price Waters, I analyzed workflow gaps, cost inefficiencies, and policy barriers. I realized that true career requires system level redesign and evidence based leadership. What worries me are structural silos, disconnected data, and disconnected people. Also, fragmented system. What inspires me is innovation that's grounded in equity. I'm trying to use qualitative listening and quantitative measurement together to build systems. As an MBA student at Johns Hopkins Career Business School, Power Center exposed me to urban livability as a measurable construct. It was my first step in connecting healthcare equity with urban policy and data driven design. National Science Foundation organized ICOR program Transform Intuition into Validated Evidence. Through over 20 customer discovery interviews, I tested my Sudha Setu idea, an AI-based navigation platform for underserved population in India. I'm trying to map my work against Bloomberg's pillars addiction, environment, obesity, violence, and equity. These are anchoring my approach in national frameworks. They are teaching me to align micro innovations with macro indicators. Citylab Catalyst became the ecosystem to test my leadership. Its learning paths are mirroring design thinking logic for myself. I'm trying to define the problem, prototyping ideas, and also building networks. It certainly has given me the language and methods to convert my empathy into enterprise and local observation into urban strategy. Fieldwork across Fells Point and East Baltimore provided contrasting data sets. Affluent neighborhoods offer wellness infrastructure, but underserved ones reveal healthcare deserts. My professional toolkit revolves around five pillars: health access, education equity, and workforce development, digital innovation, and community trust. Each pillar has measurable KPIs. From insurance literacy scores to employment outcomes, ensuring that social impact aligns with business accountability. I am developing an AI driven navigation app that simplifies insurance eligibility and telehealth for low income population. Beyond technology, it is a behavioral change intervention that is reducing administrative friction and also going to transform passive patients into active health participants. To sustain the solution, I am also proposing a workforce model training youth, foster care graduates, and returning citizens as community health navigators. This will merge social inclusion with economic opportunity, and it is going to expand health literacy while reducing unemployment as well. Baltimore's healthcare gaps reflect deep access and literacy divides. My model will empower local youth to train residents as digital health navigator using the AI-based insurance app. These navigators will help citizens understand their coverage, connect to providers, and ensure care delivery. This empowerment is not outreach, it is going to be co creation. My leadership model will invite communities to become co designer of the solutions. When people will see their insights reflected in the product, participation will shift to ownership. My leadership is integrating five intelligences: analytical for data, emotional for empathy, social for collaboration, and ethical for fairness, cultural for adaptation. Together, they are going to form the cognitive architecture for leading multicultural systems of health and innovation. As a leader, my vision is to design systems where empathy and innovation can coexist. Through two initiatives, one Sudha Setu in India and the other one Ito Sudha Global in the United States, I target to bridge healthcare, livelihood, and education across geographies. Connecting with people, having provided them with workforce development, I will definitely evaluate my model through a mixed methods logic. Quantitative KPIs will be measured, and there are still actionable items that we will be updating on phase basis. Before Citylab, I viewed social impact through isolated lenses. Healthcare access, livelihood, or innovation as separate efforts. But today, my leadership is rooted in placemaking, building systems where technology, community, and compassion can coexist to create measurable change.